Hey, I'm Kevin Kelly with Paul Gerard from Gerard and Associates. Paul, I got a question for you. What are PIPRs and why are they so bad?
PIPRs is a term that actually you coined. We coined here at GNA, but it was really from the brilliant mind of Kevin Kelly. And it's a provider induced patient refusal. And we've shortened that up to be PIPRs. And a PIPR is really just what it sounds like, is where your providers arrive on scene and they appear to, if not intentionally, try to get the patient to refuse the transport so they don't have to actually do the transport.
So, what do you mean? What do you mean? Paul G, it sounds like you have chest pain, but if it gets worse, call us back, that kind of thing?
Yeah, that a little, but there's also other subtle and not so subtle prompts that providers do. One of them is something like, hey, listen, I understand that your ankle hurts. It's not swollen. It doesn't appear to be fractured. It doesn't appear to be much wrong with it. We can take it to the hospital, but, they've got like a 3-hour wait there to be seen. So, you could also go check out somewhere else. So get checked out somewhere else. So they'll actively try to get that refusal as opposed to encouraging the transport. And, for something minor, like a minor ankle injury with no obvious injury or swelling or anything, that might sound like it's not too big of a deal. But oftentimes providers do it on patients like you're saying with chest pain. Well, I don't think it's cardiac. It's probably indigestion. Take some Malox. If it gets worse, you can call us back. Or they'll offer up. There was a case recently in the EMS news where the providers were telling the patient that it was going to cost them over $1,000 for the transport. And I don't know about you, but I could spend that $1,000 better elsewhere. So, coming out with verbiage again, whether it's intentional or unintentional, you have to be very careful how you craft your advice to patients. In most cases, you do not want to advise them out of a transport. In some systems, there are systems in place where they divert patients to other agencies, but that's by protocol, and that's designed to do that. But for most EMS agencies, you shouldn't be soliciting a patient refusal.
Well, PIPRs sound pretty risky to me. What advice do you have for me as a paramedic, Paul? I'm out there and I'm inclined. We get a lot going on. I want to get off my shift on time. This is the 30-second call on a 24-hour shift. The patient's really not that bad. What advice do you have for me to hit that reset button and start my evaluation process again with an unbiased mind?
Yeah, see, that's the problem, is in most cases, you're not going to want to hear what I have to say. Providers who intentionally do this oftentimes don't want to be told that they can't solicit these and they're going to have to do a full transport. But the advice is every patient deserves the right to be transported for further medical eval and determination of what's going on with them. We just don't have the ability to diagnose accurately in the field most conditions in terms of whether there's really a serious injury or illness. So that can be better done at the hospital. You don't want to get caught with your pants down by soliciting one of these and then having something bad happen to the patient after, and you end up getting called back. And that happens fairly frequently in EMS, where they get a second call 2 hours later and the patient's in much worse condition. So we really try to reinforce with people that those types of things happen. They are not infrequent at all, and that you're just gambling with your license, with your livelihood, with the reputation of yourself and your partner and your EMS agency. Just don't go there, right? Do the transport. If it's a legitimate refusal, that's up to the patient. Make sure that you give them all the advice and counsel that you should about being transported, and not make it look like or make it sound like you're trying to get out of doing the transport.
Well, you sound like you know what you're doing. Do you have a website or anything where I can go learn more information about this?
Absolutely. We actually have a full-length podcast on provider-induced patient refusals, and we've written articles about it, both of which are on our website, www.gerardassoc.com, and they can go to the resources tab and look at either the podcast or the articles.
Hey, Paul, I appreciate your feedback. Thanks very much, man.
Okay, man.